Childhood tuberculosis is a hidden epidemic, but the signs and risk factors are there if we look keenly. About 1 in every 10 people affected by tuberculosis are children. The signs and symptoms in children are usually very vague, ranging from cough lasting over 2 to 3 weeks, persistent fever, night sweats, weight loss or the child failing to gain weight normally, loss of appetite, fatigue, or sometimes the child may just look less playful. Other warning signs could include abdominal swelling, painless swollen lymph nodes. In rare cases of TB meningitis, the child could be irritable, have headaches, confused, vomit, and have episodes of nausea. In children, contact with a known case is very critical because diagnosis of TB in children is a bit challenging given that they sometimes have difficulties producing good quality sputum for an adequate TB diagnosis. Unfortunately, there's no contact in 1 out of every 2 children with tuberculosis. This is because a history of contact could go as far back as a year or more in childhood tuberculosis. The risk of progression from tuberculosis infection to tuberculosis disease varies with age. Children less than a year old are at greater risk of progressing from TB infection to TB disease. About 2 in every 5 children less than 1 year old who get into contact with a known case of TB go on to develop TB disease. This risk reduces in children within the age groups 2 to 5. About 2 in every 100 children aged 2 to 5 progress from TB infection to TB disease. However, this risk increases in the adolescent age group, about 10 to 20 per 100 children who get exposed to an index case of TB progress from TB infection to TB disease. However, the BCG vaccine is an effective preventative strategy for TB in TB endemic countries. The key message here is awareness and contact tracing is very important in establishing a diagnosis of tuberculosis in children. That friend, that neighbor, that relative, who has been coughing in the household for so long and is playing around the children could be a known case of TB. Therefore, contact tracing and finding the index case and treating them is very effective in preventing children from developing TB. If you found this video helpful, why not give me a like, follow me, and stay tuned for more updates. Thank you.